you divide it into 2/3 and a third. A third of it should be protein, and the other 2/3 should be colored vegetables. If you just go by that, just leaving the sugar out, leaving the starches, leaving the carbs out, the simple carbs, it will turn many problems in your body around. It was thought some years back that fructose, which is the sugar that's in fruit, was much better and slower to raise your glucose than sucrose. But fructose has sucrose in it. And if you orange juice is terrible. Any fruit juice is terrible because just think of the mechanics about it. It's all about how fast you're going to drive your blood sugar up and how high.
Right.
If it's liquid, it doesn't take any time to digest it. So boom, that glucose will hit your blood and you'll have a spike. And again, think about the caveman. He would eat an orange, a whole orange, but not juice. A whole orange has fiber in it.
Okay.
And that slows down the digestion of the glucose that's in that orange. A craving for sugar is very strong, and a lot of people have it. And I was a chocoholic. It came be 9:30, 9:45 p.m. I had to go to the kitchen looking for that chocolate. And my wife it was a game. She'd try to hide it and just see how long it'd take me to find it. And it wasn't, whatever it was that she had, I'd eat all of it. But I love chocolate. But I stopped. And it's hard to imagine, but if you'll go cold turkey with sweets for 48 hours, it's like after that 48 hours, it's like that big craving is not there anymore. Chocolate itself, the cocoa is not bad, and it has some good antioxidants in it, and it helps stimulate, produce more serotonin, which is the feel-good part of it. That's not bad, but it's the sugar that's usually attached to it, and there's even one product, and I don't remember the name, but I just saw it a couple of weeks ago, that I think it's a multi-level marketing thing, but it's a chocolate that the purpose of it is to kill your sugar drive. One little piece of this, is supposed to kill your sugar drive. But for my purposes, it's easier for me just to stop everything. And I can, I sit down, my wife has dessert, and just last night, you had a big piece of chocolate cake, and she ordered it and ate it, and another friend had the same thing, and then today she said, that chocolate cake wasn't too good. I went, really? So I didn't miss much, did I? Something else that you can do that can help a lot of things, it doesn't cost much, is to take soluble fiber with every meal. Soluble fiber is, psyllium is one of the common versions of it. There's many of those at the drugstore, Metamucil, things like that. Soluble fiber can help clean, your GI tract out. It will help lower your cholesterol, it help reduce your risk for colon cancer. It can help in many ways. But it can bind to some of the simple carbohydrates that you're eating and help reduce how much you absorb in your blood. So that's just kind of an adjunct that you can do, with every meal to help reduce your intake. Now, a really important thing to do for everyone, but particularly folks who have insulin resistance or diabetes, is to have a protein-rich breakfast. Your breakfast helps set kind of how sensitive your response to glucose is going to be for the rest of the day. And eating protein is the best thing for your blood sugar. All these children that have Pop-Tarts and those things, and then, the things, I ate 2 pieces of toast for breakfast when I was a kid. And that's just really making it hard for them. A protein breakfast. And
Like what?
eggs, bacon, uh, sausage. And let me just say, y'all are, in my generation, and my parents were taught and were scared to death to eat high fat. They thought that, eating fat, eating bacon was going to cause a heart attack. And the American Diabetic Association, American Heart Association recommended low fat, get that low fat. That's what's killing people. Well, guess what? The fat's not killing people, the carbohydrates are. Now, I'm not saying, eat all the fat you want, but the Atkins diet proved that. I mean, that doctor was well ahead of his time and was not accepted even though he had the facts. And his diet just basically said you can eat, don't eat any carbohydrates, just eat all protein, and don't worry about the fat on it. It had a lot of fat in it. And the glucose and the insulin just dropped. Cholesterol dropped. Blood pressure dropped. Eating what I do, and I think it's the breakfast of the future, is I make a liquid protein breakfast. I have a powdered mix that has vitamins and minerals and a lot of other nutrients in it. It's like a whole meal in one, but it's got 25 grams of protein and I think 4 grams of carbs, very low carb. And you just put it in a shaker with some ice, shake it up, drink it, boom, out the door. And I think that's what kids ought to be doing because it will help their brain work better. Whey protein is a really good protein source, and it not only will, is a protein sourse, but a good quality whey protein. Some low qualities don't have this in it, but they have gamma globulins in it. When you heard about, if there's an outbreak of infection, hepatitis, they give a GG shot, a gamma globulin shot to prevent it. Well, that's protein that normally comes from food. And your body makes the gamma globulin, and that resists disease. That's in whey protein, a good quality whey protein. It will boost your immune system. It's really good to have. But a drawback on whey protein versus other types of proteins is that it's kind of, and this is my personal experience, it's kind of watery. And if I do just the whey protein by itself, I'll be hungry again in an hour. But what you can do is add that soluble fiber to it, to the whey protein, give it a little bulky, and it will last longer.
Makes sense.
So that's what I have found. The protein mix that I use is a rice and pea protein, just for your information. The best eating plan for the day is 3 meals and 2 snacks. And the snacks need to be a protein snack. And the reason, breakfast is important because it sets your thermostat for the glucose regulation for the rest of the day. But if you keep giving your body the protein, it will keep that insulin down. And carbohydrates drive insulin up, protein and fats don't. Not trying at all. I started doing that just because I thought I needed to, and started doing the snacks part. I was doing 3 meals, and I lost 6 pounds without doing anything different. It revs your metabolism up, keeps it going. Now, fat has twice the number, or roughly twice the number of calories per amount of that versus protein and carbohydrates. So if you're really, trying to watch your calories, then obviously fat is a concern. And an ideal diet wouldn't be a high-fat diet. But if there's a choice between fat and simple carbs, you're much better off taking the fat. And let me just explain something I haven't talked about in the mechanism of cholesterol buildup in your arteries. That's what we all think it causes heart attacks, is that the cholesterol causes plaque and it narrows that opening and it chokes it off, and then the blood can't get through, and that's a heart attack. Well, for the cholesterol to stick to the arteries become inflamed first. And it's almost like sanding a shiny surface for the paint to stick on it. If you don't sand it, the paint won't stick on it. If you keep the inflammation down, which is keeping the insulin down, the cholesterol in your blood won't stick to the arteries. Cholesterol is not a bad thing. You will die without cholesterol. And I mean, you know, too much or too little can be bad. But it's being shown recently that, I mean, the drive or some of the urges of I've seen some patients where their doctors have wanted to get their cholesterol down to 130 total cholesterol. And that's way too low. And it's not my opinion. The studies will show that. I mean, that can cause depression. It can cause a lot of problems. Your body converts cholesterol to all of your sex hormones. If you're low in that, you're going to be low in estrogen, progesterone, testosterone. I mean, even after menopause, your adrenal glands produce estrogen, progesterone, the hormones that you need. They come from cholesterol. But the mechanism of risk for heart attack or stroke, total cholesterol, or even the LDLs, is one factor. There's other measurements in the blood like HSCRP, C-reactive protein, and homocysteine that actually are stronger predictors of a heart attack than cholesterol is. And half the people that die of a heart attack have normal cholesterol. So it's a factor to keep your eye on, but it's not the omnipresent culprit for heart attacks and strokes. One of the ways that you can reduce your body's resistance to insulin, and that's key. You know, we were talking about diet is reducing the amount of demand for insulin. We're going to reduce your blood glucose by not raising it so high. Another way to work on that is to make your body more sensitive to insulin for people like me that are insulin resistant. And one of the best ways to do that is with exercise. Daily exercise, 30 minutes a day. And I used to think that exercise, and I'm not an exercise person. I don't love to do that. And one of the, you know, I could see, you know, if I got on a treadmill for 45 minutes and it says, okay, you burned 105 calories. You know, I'm thinking, well, tonight at dinner, I'm going to take an extra spoonful, and that'll be gone like that. I mean, you know, it was just kind of useless. Yeah. But now that I know that the insulin resistance is the issue, exercise makes your cells less resistant to insulin. It will have more effect on your body than the calories you burn are really meaningless as to how this helps your health. It's stronger than any drug you can take to make your body work with insulin better. Exercise makes your body less resistant to insulin and will help you manage blood glucose better. So when I was thinking of it that way, I'm more likely. I feel like I'm accomplishing something than just trying to burn calories. Actually, I didn't put all-star by it, but alpha-lipoic acid at the top is an all-star. That has been shown to reduce your risk for Alzheimer's as well. There's a lot of other benefits for some of these nutrients.
Which one did you say?
That's the first one on the list, alpha-lipoic acid. Biotin, that's a B vitamin. 8 milligrams a day is more than you will probably find. I mean, if you look in a regular multiple vitamin mineral, if it has biotin in there, it may have 100 or 200 micrograms. And I put out to the side, you know, it takes 1,000 micrograms to equal a milligram. So it's a lot of biotin. I take that in a supplement by itself, an 8 milligram tablet. But one of the side benefits is it's really good for hair and nails.
I know, that's what I know.
There you go. I mean, I started doing that, and it's a pain. I hate it. I have to trim my nails once a week. Chromium, you should definitely have it. If you're taking a good multiple vitamin and mineral, it will have 200 micrograms of chromium in it. N-acetylcysteine is a really good one, and if you'll notice that there's a real big range in that, 400 milligrams to 3,000. There's some studies where they used just that, N-acetylcysteine, to lower blood sugar, but they had to get up to 2,000 or 3,000 milligrams level. But N-acetylcysteine can help your body detox. Your liver produces that, and it helps detox, it helps your liver work better, so it can help in other ways. And curcumin is great. That's, turmeric, the spice. Curcumin is what makes it yellow. And you can get that, as an extract. And that is got some really good studies for being anti-cancer. I mean, really good ones. And actually, I think MD Anderson is doing a trial right now using it as a chemotherapy. It's also a natural anti-inflammatory. I recommend it for people that have osteoarthritis and a lot of them, if they're on Coumadin or something like that and can't take NSAIDs, for pain, then I put them on a strong dosage of curcumin. Now there is, on most of these this is true, but on curcumin it's hard to absorb, and a better quality one is going to be better for you. A lower quality one, you'll be wasting your money. When I mentioned about curcumin, there is good quality and there is lower quality. That is something that really in nutrients you usually get what you pay for. And it's not only that you don't get much, if you pay less for something,